What is diabetes mellitus? Diabetes mellitus is a disease that prevents your body from properly using the energy from the food you eat. Diabetes occurs in one of the following situations: the pancreas, an organ behind your stomach, produces little insulin or no insulin at all. Or the pancreas makes insulin, but the insulin made does not work as it should. This condition is called insulin resistance. Insulin is a naturally occurring hormone, produced by the beta cells of the pancreas, which helps the body use sugar for energy. To better understand diabetes, it helps to know more about how the body uses food for energy, a process called metabolism. Your body is made up of millions of cells. To make energy, the cells need food in a very simple form. When you eat or drink, much of your food is broken down into a simple sugar called glucose. Glucose provides the energy your body needs for daily activities. The blood vessels and blood are the highways that transport sugar from where it is either taken in the stomach or manufactured in the liver to the cells where it is used, muscles, or where it is stored, fat. Sugar cannot go into the cells by itself. The pancreas releases insulin into the blood, which serves as the helper, or the key, that lets sugar into the cells for use as energy. When sugar leaves the bloodstream and enters the cells, the blood sugar level is lowered. Without insulin, or the key, sugar cannot get into the body's cells for use as energy. This causes sugar to rise. Too much sugar in the blood is called hyperglycemia, high blood sugar. What is the mechanism of action of insulin? Insulin binds to specific receptors, tyrosine kinase receptors, present on the cell membrane. Binding of insulin activates tyrosine kinase activity, resulting in phosphorylation of tyrosine residues of the receptor. This results in the complex series of phosphorylation-dephosphorylation reactions, which promotes entry of glucose into cell and mediates various actions of insulin, that are 1. Inhibits of glycogenolysis, gluconeogenesis and lipolysis. 2. Promotes protein synthesis by enhancing amino acid entry into muscles and cells. 3. Promotes peripheral utilization of glucose and K+ uptake into the cell. What are the types of diabetes? There are two main types of diabetes, type 1 and type 2. 1. Type 1 diabetes. It occurs because the insulin-producing cells of the pancreas, beta cells, are damaged. In type 1 diabetes, the pancreas makes little or no insulin, so sugar cannot get into the body's cells for use as energy. People with type 1 diabetes must use insulin injections to control their blood glucose. Type 1 is the most common form of diabetes in people who are under age 30, but it can occur at any age. 10% of people with diabetes are diagnosed with type 1. 2. In type 2 diabetes, adult-onset diabetes, the pancreas makes insulin, but it either doesn't produce enough, or the insulin does not work properly. 9 out of 10 people with diabetes have type 2, and it occurs most often in people who are over 40 years old, but can occur even in childhood if there are risk factors present. Other types of diabetes might result from pregnancy, gestational diabetes, surgery, use of certain medicines, various illnesses and other specific causes. What is gestational diabetes? Gestational diabetes occurs when there is a high blood glucose level during pregnancy. As pregnancy progresses, the developing baby has a greater need for glucose. Hormone changes during pregnancy also affect the action of insulin, which brings about high blood glucose levels. Pregnant women who have a greater risk of developing gestational diabetes include those who are over 35 years old, are overweight, have a family history of diabetes, have a history of polycystic ovarian syndrome. Blood glucose levels usually return to normal after childbirth. However, women who have had gestational diabetes have an increased risk of developing type 2 diabetes later in life. What causes diabetes? The causes of diabetes are not known. The following risk factors may increase your chance of getting diabetes. 1. Family history of diabetes. 2. Being overweight. 3. Physical stress, such as surgery or 4. Use of certain medications, including steroids. 5. Injury to the pancreas, such as infection, tumor, surgery or accident. 6. Autoimmune disease. 7. High blood pressure. 8. Abnormal blood cholesterol or triglyceride levels. 9. Age risk increases with age. 10. Smoking 11. History of gestational diabetes. Note, it is important to note that sugar itself does not cause diabetes. Eating a lot of sugar can lead to tooth decay, but it does not cause diabetes. What are the symptoms of diabetes? The symptoms of diabetes include 1. Increased thirst, 2. Increased hunger, especially after eating, 3. Dry mouth, 4. Frequent urination, 5. Unexplained weight loss even though you are eating and feel hungry, weak, tired feeling, 6. Blurred vision, 7. Numbness or tingling in the hands or feet, 8. Slow healing sores or cuts, 9. Dry and itchy skin, 10. Frequent yeast infections or urinary tract infections. What is the treatment of diabetes mellitus? Diabetes may sometimes be controlled with a combination of diet, weight management and exercise. However, treatment may include oral glucose-lowering medications taken by mouth or insulin injections, shots.